Peace be to you all. Assalamu alaikum. Omar Abdul Malik, physician assistant slash associate and health educator here, as usual. I wanted to do a follow-up video about advice for new PAs. So if you've been a PA for, whether you just graduated or you're maybe 2 or 3 years into that first job, one of the things that I cannot stress enough is the importance of documentation. I've been involved in investigations over the years. I've been a PA for more than 20 years. I've been in the healthcare field for more than 30, starting out as a certified nursing assistant back in 1990. And I've been involved in investigations, whether it's me personally getting investigated or the facility for which I'm working. That's usually the case if you get involved in an investigation, because patients and their family members, they're not interested in really suing individuals. If you sue a doctor, it's not, how much money are you going to get? But you sue the hospital or the nursing home or whatever facility with which the clinician is associated. That's where the big money is, where your multi-million-dollar settlements are concerned. But if you've ever seen that patient, even if all you did was eyeball them, and that's like you give them a brief one over, yep, he's breathing. There's no way, what we call eyeballing the patient. That's still a form of assessment. That's still a form, that can still be considered a form of interaction or evaluation of that patient. So if something happens, best case scenario, maybe the patient's got a complaint about they didn't like the food or the service, whatever. I had a guy wanting to sue a big hospital because he got a hematoma. They were trying to do a blood draw on him, the phlebotomist was, but he was an IV drug user for years, so his veins, it's very difficult to get a blood draw on him. But he's like, I'm gonna sue that hospital. Look what they did to my arm. What are you gonna do? But worst case scenario, patient may die, and the family wants to sue. You have to document. So if they actually file a lawsuit, and if you so much as looked at that patient or touched them, said, I think you're okay, or go to the ER, I don't know what this is, so you can have more tests. You need to document that, and it's a pain in the neck. It is a pain in the neck, man. I can't stand documenting. You gotta dot your I's and cross your T's, but it will save you. It saved me, because they've looked and I was like, wait a minute, that patient said you didn't do this, that, and the other, and here it's documented. I was like, yes, haha. So it would behoove you to take out the several minutes that it's going to take for you to do proper documentation. So one of my responsibilities as a hospitalist PA is running codes, code blues, stuff you see in the movies and in the TV shows. You're doing chest compressions and all that stuff. So if the patient dies, I have to say, okay, this is what we did. This is why the code blue was called. It was a rapid response first, then a code blue. Did ACLS protocols. This is the epinephrine that we gave, or atropine, or whatever IV drugs you're pushing. This was the result. Called the family, called the attending. All that has got to be documented. And then I, double and triple check it with the nurses and other staff. I work with some awesome nurses, man. My God, just incredible. And a respiratory therapist. And we check over each other's notes and say, okay, this is what we did here. Okay, you ambu-bagged, or this person intubated with this size intubation tube or whatever. And that way you have your stuff together. You're like, okay, we got our documentation together. Maybe the results were not what we wanted. Maybe the patient died or whatever, but we did what we could. And that's all you can do. because there's really, unfortunately, no statute of limitations anymore when it comes to filing these lawsuits. So you got this commercial of giving these guys free advertising. Greenberg and Betterman, if you have a phone, you have a lawyer. No matter how long ago it was in the past. So people are suing. They're full-grown adults, and they're trying to sue their pediatrician or the OBGYN who worked on their mom. When they were delivered, to say, oh, you caused the birth defect in me because of so I'm suing you for malpractice, even though it's 20 or 30 years later. So you don't want to be in the position of having to defend yourself. And sometimes, you just can't. Every now and then I'll have a patient who I haven't seen in years call me up because they have a class action lawsuit against some pharmaceutical company. There's the big payout by the thank you, by the pharmaceutical companies for the opioid epidemic. And somebody who I haven't seen in 10 or 15 years will call me up, or because my number is listed, unfortunately. Hey, I'm suing this company. You remember you gave me this particular medication? You wrote a prescription for that. You got the records for that? It's like, dude, what are you talking about? I barely remember you. I thought you were dead. Well, I don't say that, but I don't remember every patient I've treated over the decades. I had a situation when I was a nursing assistant. A patient was found, he had slipped on the floor or something. Died. I don't know what happened. I found him on the floor. He's dead. So I told the charge nurse. And I resigned because I had finished school, but he wasn't even my patient. But the family wanted to sue the nursing home, and I got a call from an investigator. Well, did you find him on the floor? What position was he in? Was there any water on the floor? Was he bleeding? I was like, I don't remember. And this was almost a year after the fact. After that, after I resigned from the place. It's like 25 years ago. But that's when this happened. But that's the way it is. So you knew PA's document. Most hospitals, I think, have moved toward electronic medical records, but or a combination thereof of the written and electronic medical records. So make sure you document on both of those forms if necessary. Have somebody check over your documentation. Don't let your ego get the best of you. Say, look, nurse, can you check to see you were in this situation with me? What do you think about that? Is this what happened? Yeah. Okay. And they may say, no, we gave 6 epinephrines, not 4. I say, oh, okay. It's easy to lose sight of what's going on in that situation sometimes. But that's it. So I hope you guys heed those words. Documentation. I guess that's all I have to say about that. Oh, and prescription writing. That's part of documentation. I've had patients be discharged from our hospital and call me, months later when they were supposed to have a follow-up appointment with their primary care. Say, oh, we couldn't make the appointment because of whatever reason. Can you give us some more prescriptions? I was like, no, I can't. You're no longer my patient. You've been discharged from our hospital. They usually want opioids medication, which I'm definitely not writing for. But be careful, especially when it comes to your documentation for prescriptions, because these things are followed. Your license number and NPI number, unique provider number, and what are you doing? And DEA number and all that good stuff is on. That's yours. Well, it's not yours. It's the Department of Health's. But be protective of it. That's it for now. Take care.